since we are making an understanding of polycystic ovary syndrome. Now, before we really go into the intricacies, let me just discuss two cases of polycystic ovary syndrome, because I feel polycystic ovary syndrome is not a spot diagnosis, but it is a spectrum of disorder. And as a doctor, when I see a case of polycystic ovary syndrome, I like to put up on what part of the spectrum you are. And like, are you on a comfortable part of the spectrum, or are you on a problematic part of the spectrum? Let me give an example. That this girl I saw today, she's 22-year-old, she's a working professional, and she's also pursuing her PhD. And interestingly, she has some psychological topic in which she's pursuing her PhD. She went for an ultrasound, an abdominal sonography was done, and they said that, well, you have polycystic ovary syndrome, the ovaries appear polycystic. And in a hurry, she Googled, and somehow she landed up in an MRI clinic and went for an MRI of the pelvis, and again saying that it is polycystic ovary like picture on the ovaries. Otherwise, uterus, everything is absolutely normal. So she got this feeling that she's suffering from polycystic ovary syndrome, and she started Googling more and more, and then came to know that there could be risks of malignancies or risks of infertility, etc. And thus she landed up to my place for an opinion. And I just asked her, do you have irregular cycles? She said, no, I don't have irregular cycles. I said, you don't appear to be having an obvious acne on the face, but do you go to the parlor very often to take care of your upper lip hair or chin hair, etc.? Or do you have an excess hair on your body? She said, well, I have some hair on the forearm, but that's hereditary. Everybody in my family, all the women have it up. I said, fine. But the ultrasound picture of polycystic ovary is not something diagnosed on an abdominal scan. You have to do a transvaginal scan. Since you're not married, you're not going to go for a transvaginal scan, and let's do an AMH level, because that is a surrogate marker for knowing whether it is a polycystic ovary. So we did an AMH and we just came 3.5. I said, well, you definitely do not have a polycystic ovary syndrome disease. So remember, when we are diagnosing polycystic ovary syndrome, we have to have irregular cycles, a polycystic ovary morphology on transvaginal scan, or an AMH level generally beyond 4.5, or you have to have a hirsutism, obvious excess hair on a body which make you very, very conscious. Let me narrate you a second story. Now, this lady comes to me and she says, well, I always had irregular cycles. I don't get periods unless I take some tablets. And she's very plump and she's about 92 kgs. She obviously has hirsutism. And when I look at her ovaries on ultrasound, I feel the ovaries are very big and they are having more than about 25 follicles on either side, and all the follicles are less than 4 millimeter size. I get an AMH level done, and which comes 11.7 nanograms, and an LH level is also around 20. Now, this is what I call a severe grade of polycystic ovary, where you have obesity, you have a high LH, a very high AMH, you have ovaries which have a rosary pattern on ultrasound, having more than 25 follicles. Now, both these clients are extremely different. The one first is just a perception that she's a polycystic ovary, but actually she's not. On the other hand is one case of a classical polycystic ovary. So if somebody tells you that you are suffering from a polycystic ovary, or you're making a self-diagnosis, you must have irregular cycles, of cycles coming beyond 35 days, or you do an AMH level, should be beyond 4.5, higher the AMH, bad is a polycystic ovary. If you do an FSH LH level, generally we find the LH level to be higher, but it is not mandatory to have this as a criteria. You should have excess hair on a body, especially if you're having some hair on the chin and upper lip is very common, and the girls are generally very conscious about it. But if you're having hair on the thighs, or hair on the back of the thigh, or hair between the umbilicus and above like a male pattern, or hair around the breast or in between the breast, now that you should be very conscious about. That means you definitely have a little higher androgenic levels. And if you have all these pictures, any two of the three positive, then you are one of the types of polycystic ovary. So we obviously do all the investigation and put you which part of the spectrum you are. And the key portion of the treatment is moving you. Can we move you from a bad side of the spectrum to the good side of the spectrum? And that is what is going to give you a faster mental health, a better mental health, better menstrual cycles, and a faster pregnancy as well. I hope this helps. Okay.